A skilled communicator will discover what the patient wants. All we need to do is ask appropriate questions. But you need to make sure that you are expert enough to give the best advice to meet the patient's requirements. We also need to be sensitive to the patient's needs and wants. When helping people choose frames, then you want to assess if the patient is warm or cool colours and try and guide them to styles and colours that are going to suit them. Think about how they look and their lifestyle. If you get the patient to try something like this on, they could walk out and never try anything else because they think that you're not on their wavelength as to what they look like in the frames. With this patient, it's quite easy because she's warm tones, and so warm frames will suit her. Often all you have to do is look at the patient's jewellery. So this lady's wearing a gold watch and a silver necklace, but she's got nice clear complexion and blonde hair. So you'll find that warm colours suit blondes better than cool colours. A very easy way of telling if people are warm or cool colours is to use a pashmina like this. So here we've got a cool colour, and if we place that on the patient, suddenly she looks sallow skinned, and you can see the grooves around her mouth, the lines. And if we compare that to a warm shade, so if we pop this one on top, and suddenly the colour's brighter, and you can see it adds a glow to a skin tone. So we know that we need to find frames that are warmer colours, so like golds, bronze, shades of pink will really suit this patient. The golden rule about selecting frames is choose the opposite shaped frame to their face. If they've got a round face, then select square or rectangular shaped frames for your patients. And if they've got a square face, then choose a round or a slightly curved frame for your patient. It's very important to check the patient's face shape. So Judith has an oblong face. So if you put that frame on for me, what we want to do is try and balance the features. So with this frame, it's too heavy on top, so it cuts the face into two. So what we need to go for is a slightly deeper frame. So if you put that one on for me. With this frame, we've got more lens depth, but a high bridge. And so it increases the length of the patient's nose. So what we're trying to aim for is a frame that's well balanced. But with this frame, it's too square in shape, so it makes Judith's chin and forehead look squarer in shape. So an ideal frame would be that with a bridge in the centre and equal distance top and bottom for the fitting. That's beautiful. Sometimes patients choose frames that you think are totally unsuitable but that they love. But you can always compliment the patient. So you could say it's good colour, or it's a good style, or it's a very nice fitting. In this case, we'd go for a good fit.